Good morning, everybody. Just going to a couple more minutes for people to arrive because I can see that it's getting a bit busier. See some familiar names. Okay. Right, I'm going to get started. Hello, good morning, everybody, or good afternoon, because I know there are a few people that are calling in from Denmark. Hello. Welcome to our session today, how care homes can introduce cognitive stimulation therapy. My name is Fiona Costello. I'm Senior Vice President of Partnerships at Brain Plus, and I'm delighted to be your host for today's webinar. Some of you may have been on a couple of our others, so you'll recognise our faces. So today, we are going to be talking about CST and why it matters. But for a little bit of context, which won't be new to any of you on this webinar this morning, across the UK and indeed the world, dementia is the defining challenge of later life. Around 70% of care home residents are living with dementia, and in some homes that figure exceeds 80 to 90%. This means that dementia care isn't a specialist niche, it's the everyday reality shaping staffing, training, inspection outcomes, and residents' quality of life. And yet, Skills for Care highlighted that only 29% of the social care workforce have received specialist dementia training. The impact is felt across every part of the home. Residents with dementia experience high hospital admissions, greater use of antipsychotic or sedative medication, and longer lengths of stay, while staff face greater emotional and administrative burden. From a financial perspective, dementia in the UK currently costs around £42 billion a year, and this is projected to rise to approximately £90 billion by 2040. Many of these costs fall on social care and unpaid care systems, including care home services. Despite this, most homes still rely on general wellbeing or activity programs rather than structured, evidence-based cognitive supports. That means a significant portion of residents are missing out on interventions proven to slow cognitive decline, improve communication, and enhance daily functioning, all of which directly influence CQC outcomes, family satisfaction, staff morale, and the experience of residents living with dementia. So today, we're going to be exploring how cognitive stimulation therapy, or CST, can be introduced and scaled across care homes, supported by digital tools like Ayla, your CST Assistant, and we're going to tell you a little bit about the impact that we've seen. Before we get started, I know there are people still joining, but a few quick housekeeping notes. This session is being recorded and will be shared afterwards. Please use the chat function, the Q&A function for any questions, and we'll address as many as possible towards the end. But for those that we don't get time to, we'll give you written responses. So to begin, I'm delighted to be joined by the Chief Executive of Brain Plus, Devika Wood, who will be providing an overview of what CST is and why it matters. So over to you, Devika.
Fabulous. Thank you so much. So yeah, a huge welcome to everyone that has joined this webinar today. We're really excited to have you here. I'm particularly excited to be co-hosting this with the incredible leadership team from South Care Homes, who were our first adopters of CST, pioneers to put this into a care home setting. And you'll shortly be hearing about the remarkable outcomes and the benefits that they have received through implementing CST through Ayla. So for those that are on the call that may not be aware of what cognitive stimulation therapy is, I always refer to it as a little bit of magic. I've been a young carer for my nan for 12 years. I've been in the space of dementia for a very long time, from lived experience to professional experience. And actually, I had never heard of cognitive stimulation therapy until I took on this position at Brain Plus. And I am really, really sad that I never heard about it, because I believe it could have had the most profound impact on my nanny, but also the family members that were caring for her, which was myself and my parents. And so hopefully by doing what we're doing, we can expand the access to cognitive stimulation therapy for everyone and anyone. So an overview, cognitive stimulation therapy. It is the world's leading non-drug intervention for mild to moderate dementia. What does this mean? It's NICE recommended, and it's the leading non-drug therapy proven to improve cognition in those living with dementia. It's actually the only non-drug therapy that is recommended for dementia residents on NICE. It's recommended by the World Health Organization, and the Alzheimer's reports always mention how cognitive stimulation therapy is absolutely brilliant as an intervention for those living with mild to moderate dementia. The format of CST is group-based therapy. So you'll have 5 to 8 individuals that will be receiving this therapy, and it's delivered by a trained CST facilitator. The reason why it is magic is it's made up of activities that are evidence-based, and those activities are laced or embodying all different varying types of therapeutic interventions that improve cognition, and the clinical benefits are delaying cognitive decline by up to 6 months. It measurably improves mood, communication, and engagement. And when people are partaking in these activities, the recommended dosage by NICE is 7 weeks, 2 sessions per week. Each session on those 2 sessions lasts about 45 minutes to 50 minutes. And in that time, you will see beautiful moments, memories, communication, conversations happening, which are absolutely wonderful to watch. And more than that, just show remarkable outcomes on those sessions, but actually after that 7 weeks as well. The therapy is globally adopted. It's implemented across 35 countries. It's really, really cost effective to deliver. It's shown to have better outcomes than most of the drugs on the market because there are absolutely no side effects. It's really brilliant. At the moment, before we've kind of brought it into the care home settings, it had traditionally been delivered in the NHS. So at point of diagnosis, people will be receiving CST or referred onwards for CST within the NHS setting. As an organisation, we believed that that was absolutely where it should not be sitting, and actually to make it accessible and scalable, it needs to be in the hands of social care providers where we could truly make the biggest impact. So what I always say is 7 weeks is the group session CST. So imagine if in just 7 weeks, you as an organisation, as a care provider, could see an improvement in cognition by 50%, a boost in quality of life in residents by 48%, and an improvement in social life, mood, adaptability, and hopefulness from 23% to 50%. Now, these data and statistics are not made up. These are real world data that we collected in South care homes from just 7 weeks of implementing CST. And this is actually clinically evaluated data, because if you look at all of the research, all the clinical evidence around CST, all the academic research has shown these remarkable improvements. And all that we are doing is bringing it into your homes to the residents that really, really need it. And what Fee had mentioned before, that there's been multiple studies that have shown that staff have reported these positive changes in behaviours, reduction in anxiety and distress. But where we've really seen a remarkable ability to actually change the way that we deliver therapeutic interventions is care homes are seeing a 50% reduction in sedatives and 100% reduction in antipsychotic medication when implementing CST. And it's something that Brain Plus and if implementing Ayla, we're really keen to start exploring this with care homes. And so we are bringing this NICE recommended dementia therapy into the hands of everyone. It should be implemented as a first-line defence. It should be embedded as the activities cadence in all care homes everywhere, because if those living with mild to moderate dementia, early signs of cognitive impairment within care homes, if we can intervene quickly with an evidence-based therapy that can delay cognitive decline by up to 6 months, can improve cognition within 7 weeks, then the impact and the ROI on the rest of that care home, on the commercials, on the business value, is going to be absolutely remarkable. And not just that, the impact on other residents. If we can improve the lives and the quality of life of those living with dementia, and then mixed with those that are not living with dementia or maybe earlier on in their diagnosis, you will see such a huge impact in the way that the residents are interacting with each other, living with each other, and engaging with each other. So I will now hand over to the amazing duo, Karim and Antonina. So Karim is the owner of South Care Homes. Antonina is the fantastic care home manager at Grasmere. We have had the honour to work with them implementing Ayla into their care homes. And more than I've ever seen is that when a leadership is implementing a solution, it's driven from the top, that they are really passionate about embedding effective dementia care. You just see the care home take it up like pure magic, and that's what the team has done. And their activities coordinators who are delivering CST, that we have trained as CST facilitators, so they are now dementia therapists. Hopefully they will tell you how remarkable they've seen the impact on both the activities coordinators that are delivering this and the residents' lives. So over to you both to share the outcomes and your experience.
Thanks, Devika, and good morning, everyone. Hope you can hear me okay and see our slides. We'll crack straight on. Okay, so, my name's Karim. I'm the owner of South Care Homes. We've got a group of 5 residential care and nursing homes, ironically based in the south. And Antonina here is my manager.
So I'm the registered care home manager for Grasmere Rest Home. We are a residential care home and a dementia residential care home. We're actually proud of what we're doing. I think we are, like Karim said, pioneers in dementia treatment, not only medicated treatment, but CST related. And I think that matters a lot for the well-being of our residents. And that's our first
yeah. No, that's fine. Yeah, I mean, I ironically as well hadn't even heard of CST prior to exploratory conversations with Devika and her team, and absolutely really blown away with the theory. And obviously we had experience of, or certainly Devika and her team had experience of working with care homes, but not in the UK. And so we were really quite excited to be partners really in this venture into the UK. Really interesting for us as this is evidence-based, with CST being clinically proven as well. So that was a really good kind of key kite mark indicator that this therapy, it being NICE recommended as well, cost effective, Devika indicated. But from my background being people related, we certainly have our teams at the forefront of everything that we do and the residents at heart. And just by the hand in glove approach the team have worked with us to train our teams up with the model, with using CST and the Ayla platform, has been really, really comforting. And for us, just upskilling our staff team members in this therapy has been really, really groundbreaking, and only going to enhance their ability to engage with and interact with the loved ones that we have under our care. So one of the things that Devika and Fiona have asked us to talk about are kind of steered on these slides, so hopefully we can plow straight through why we joined the pilot.
So, like I said, we are a residential care home and dementia residential care home, and we always wanted to make a better life for our residents, to give them the best quality, the golden years, if you would like, of their life. We are very passionate about this, and we have worked really hard to give them everything that will improve their life daily. We have activities coordinator that is actually brilliant. We are very proud of him. He's very dedicated, and he's engaging with our residents, making activities person-centered for our activity, for our residents. Even if they're having like a group activities or one-to-one, it's just to make sure that everyone is included. We did start to look at programs for CST. We do have other digital systems that we're working with, and we're really, really happy with that. We have Rita, we have My Life TV, we had the happiness program as well. Like I said, we're trying everything to make sure that we're not going to live in, in the old days when we used to medicate our residents, and that was it. We are just trying them to be as happy as they can be. And after that, we heard about Ayla. We were obviously excited. Karim, I think it was the most excited of us. And I have to give him a reason, because it was really, really good, a very good program, very well presented. We were really happy to see that somebody actually took everything that we're doing for our residents and make it an app so easy to use and so engaging that actually is it's exactly what we wanted, exactly what actually engage our residents to be active on that person, and it's taking everything like physical activities and also more like mind kind of activities, and it was actually mind opening for us. We really enjoyed it. How we started, we are currently, I'm very proud to say we are currently on the second program of Ayla. So we finished our first one. We started in June.
Summer, yeah.
In the summer, we had 14 sessions twice weekly. We had a group of 6 residents. Some of them, they had mild to moderate dementia. Some of them, they only have mild cognition, like Fiona said, and Devika, actually. Everyone is welcome in this program. That's the beauty of it. Nobody's feeling left out, or it was actually very, very engaging for everyone. We had a lovely training with everyone from Devika, Fiona. I know Simon was there, Josephine. We had so much support from the group that give us that boost, make us more excited about Ayla. And the fact that we had everything prepared from you guys actually helped a lot. Yeah, it was really easy to set as well on the system. I'm just
and I think it's also very confidence building with the Ayla team, so that we're able to, like I used the term hand in glove before, and I think that those partners were really helpful there. For example, there was anxiety, certainly from my side, about how we engage this with family members. CST doesn't sound terribly family friendly as a terminology. I'll be honest with you. You almost think about the beautiful mind type stuff, but actually, ironically, it's a real friendly, warm environment that is nurturing and is a safe space for our residents. And for me, it was really important that Antonina and her team articulated effectively and efficiently what Ayla was and what Ayla how Ayla can benefit and what it does. Ironically, you've got some anxious residents, relatives anyway, when their loved ones have the diagnosis. So this again provides them with some level of comfort that there are some interventions out there that aren't shock based or medication based. And actually, the fact that this also was at the forefront of our team's minds of who were going to deliver this is key. We had a really interesting time with the training pre-launch with our team. So whether they were frontline healthcare assistants, in fact, we've used managers, Antonina, in other care homes as well, have joined the training. We even had administrators and activity coordinators too. So we had a blend of individuals who throughout the day would have different varying interactions with our residents. But for the sessions itself, you have maybe a lead facilitator with someone supporting. And if all your members of the team that you identify have some visibility of how each sessions are going, they again will develop and enhance their activities as and when. So maybe we'll go into a little bit more about the engagement levels a bit more.
Yeah, so first, I have to admit, like Karim said, the families were a bit skeptic. We didn't want to engage even residents. I remember the first sessions with some of my residents, they were a bit convincing, they say, from our side. We just had to explain them. We called it the brain training, actually, that actually worked brilliantly, because that's Ayla. That's actually Ayla. She is using parts of the brain that is actually making them more engaging, and that's exactly what Ayla was doing. So our brain training session, how we used to call them at the beginning, they were really, let's say, dragging for the first one. Before, they were very reticent to participate, but after that, they were waiting for our sessions. They were engaging as well. They shared a lot of information that we couldn't have. Even the family, they didn't know about those ones. And I think that was the brilliant thing of Ayla, because like the brain training that we were discussing, they were accessing memories from the childhood that they haven't even shared with their families. And we had that one of the ladies, I'm not sure if I can pass examples, one of the ladies has shared with us that she was told in China when she was a child. So she was so confident and so, I think she was so comfortable in that group, in that sharing of information, that she actually shared something that she was ashamed of. That's part of the memories going back, and confidence of speaking about different information. Some of the other residents, actually, we have one of the residents actually that he's always a joker. He's always taking everything a bit like a laugh, but he enjoyed it. He loved every session, actually. He was sharing information again, memories from his young self, let's say, that they were very intimate. And that's what Ayla does, makes connections with other people, makes, the memories that they're sharing, that they actually remember during Ayla, it's very important for them. And I think the training that we had, like, I remember that the Ayla group were always telling us, just give them time. It was part of the training also, and just supporting that resident to share as much as possible. It was something that actually we were really surprised as well.
So Antonina was one of the lead facilitators.
Sorry, I'm excited.
She was excited, and I had the pleasure of observing one of them and just walking into the room, feeling the energy. And you take them away from the environment of a lounge, and you're able to, as the picture shows, here in a smaller room where they can share these details. They feel like it's a safe space. They're comfortable. You can see tea, coffee, snacks to keep them hydrated and motivated and whatnot. And I think watching some people singing who ordinarily wouldn't sing was game changing. And I think there was definitely a sense of achievement from the South Care Grasmere team that this was something impactful. And Fiona mentioned the word meaning, moments, and magical. And I'd say this is definitely a meaningful moment for my residents.
Even the family have noticed, actually.
Well, that's the next slide.
Yeah. So they have noticed positive changes in their behavior. They were more happy. They were more engaging with the families as well. They were more chatty. Sometimes, I remember one. Everybody loves their relatives. Don't misunderstand me, that. But at one point, I remember one of them, they have sent their relatives home because I have my meeting now. So they put Ayla first before the meeting, and above their visit, and that was really sweet to see. Actually, they were sharing what they were doing during Ayla. We were actually painting on that time, on that session, that specific session. And the resident, he usually doesn't like to do that because it's a girly thing, but he really enjoyed it. And having that community of the activities, and I don't know.
A smaller group as well, only having 6 or 7 residents was was really key. Rather, I mean, we're certainly not one of those big care homes. We've got 23 residents at this home. We've got other homes. Our maximum sizes are 30. So I guess size-wise, we're able to kind of ensure an intimate environment and a safe space. Do you want to speak a little bit about how your staff have benefited? Because I think this, the upskilling.
Yes. So, like I said, we do have a brilliant activity coordinator. He's doing everything for our residents, and he's very, very dedicated. But as everyone, I think change and a new application, new systems are always challenge. He has blossomed, if I can say that, with the support that we had from you guys, from Ayla as well, from Josephine, always pestering us how it's going, how I can help, how I can do something like that. I think he gave him that confidence that, and also the feedback from the residents that give him the confidence that it's a brilliant program, it's helping. And he grew in confidence as well. He was more open to say. He was sharing as well memories from his childhood. And I think that's the only thing we are all sharing it, and we are all participating in Ayla, and really, really helped him as well.
One thing I'd probably add to that was when we were planning our groups, we were very keen on considering not only training up our team members, our staff, but also potentially blending in one or two residents' relatives. Sadly, they couldn't make it due to the commitment on one of the days. But it's something to consider in our next iterations of making sure that actually family members feel part of this journey as well.
We usually have involved them. We always keep track of families. They're very engaged, and they're trying to find out exactly what happened to the session. What did my mom or my dad shared? Like I said, they're more open with their relatives as well, and that's the beauty of it. We did have a few challenges. Like we said, we are a small care home. Finding the time in the day with dementia resident it's a challenge. We're trying to make sure that we have the time, we have the space, we have the quiet, let's say, time. You can speak about that in a residential care home, but just to make sure that the residents are more active, they're more prone to participate. So we picked the mid-morning for our session, and it worked for us. It was really good. Like Karim said, we had a room where we can fit all our group just to have that comfortable, coziness, and that helped with the program. Again, we had the challenge of residents participating. We did have to explain to most of them several times what is Ayla, what is doing, what we're trying to achieve with that. Or for some of them, because of their dementia being more advanced than others, we had to explain them daily, even 2 or 3 times during the session. But at one point, they weren't asking why they're doing this one. They knew they have to do it just because they had that good feeling after, if makes sense. So they didn't know exactly.
There was definitely a buzz after, and they had the endorphin levels high.
That's the thing. So they didn't know exactly what we're doing there, what was called or whatever, but they knew exactly that they're going to be happy after that. They had that good feeling. So these kind of things that we were quite happy to see. Another challenge was to maintain engagement. Like you all know, dementia residents, they are fluctuating in enthusiasm, in participating in activities. But because Ayla is so diverse and we had different activities, not only, like we said, mental activities, we had also physical activities. I think it was really, really helpful. And the way it's structured has helped a lot with the engagement. And our last challenge is going to be actually, we're trying to include everyone in the home. Like we said, we do have our second group now, and after that, we're going to have our maintenance group, like we used to call them. So we're going to do with the whole home. Yeah, we're just going to do it with the whole home. And yeah, it's really exciting.
I think the varied activities help actually because, as a learning style, some people are very visual, some people want to be on their own. And in a similar environment, people can entertain themselves or engage in themselves in this platform in a multidisciplinary approach. So you'll have singing, you'll have visuals on a computer screen, you'll have touch and books and paperwork in front of you. They can do some coloring or drawing or writing. And similarly, they can just verbally, orally, just start discussing things in multiple ways. So, and there'll be times where some of them kind of drift off into their thought mode because you know that they're perhaps processing something, and then they'll come back in the room and they'll be like, magic.
It is magic. Okay. Sorry, I think we're just a bit
Conscious about time.
Yeah, sorry.
But support from the Brain Plus team, I think they've been exceptional all throughout the touch points, every step of the way. We're not quite sure. And one of the key areas that I think they supported us with was almost how do you capture this data or this feedback or how the improvements are, because some of it is so qualitative rather than quantitative. And in order for us to be able to say, have we made a difference with this program? We were able to use the subject matter experts at Brain Plus to be able to ensure that the Ayla platform was effective and meaningful for our residents. So that was really good. And Devika and the team were very receptive to our silly questions and not so silly questions. So that was good.
It is. So outcomes, like Karim said, we've had very, very positive impact on our residents. We're very proud to share this information with you. I'm not sure, I'm sure Devika is going to go walk you through the process, but we're just gathering information at the beginning, mood-wise, the cognition, the quality of life, or whatever social life they think they have. And after that, after the ending of the sessions, the 14 sessions, we're going to ask the same questions again. And as you can see, the results are speaking from themselves. So we are really proud about this. And
so for those who can't necessarily see the slides, you're looking at energy levels increasing by 25%, mood levels definitely increasing, memory increasing, self-perception increasing, and even things like planning daily activities, recalling action and intentions, and feeling understood when talking. All of those are perhaps things that we take for granted, but having that articulated by our residents and loved ones, I think, speaks volumes. Any closing statements from you before we hand back over to the team?
Just one thing, I couldn't be more proud that we were part of this. And I want to thank you, Karim, because you pushed a bit our limits as well. And Devika, that you and all the team, we're really, really happy with Ayla. And we're going to continue working with you guys. So that's from me.
Over to thank you to the team, definitely really helpful, so much so that we originally piloted this with 2 of my care homes in the south, and we've just signed up for another 2 care homes to join the fund. So really grateful, and definitely flag flyers. Thank you.
Amazing. Oh my goodness. I was getting quite emotional through that. But thank you so much for sharing all of that. And I will now quickly go on to what is Ayla and what is CST in terms of the programme, because I've seen that there's been a number of questions about it. So as I mentioned, CST is an evidence-based therapy. So it's been around for 20 odd years. It is constructed through activities that are made up of supporting communication, reminiscence, reality orientation. The whole construct of bringing together these different modalities of therapies have created what is called CST. And as I said, it's evidence-based, it's structured. So you have 7 weeks, 2 sessions per week. That is your initial CST group. And then as the team pointed out, you move over from 7 weeks, 2 sessions per week into maintenance CST, which is 1 session per week over 24 weeks. Every week is a different activity, and that activity is bringing out all those different modalities of therapies into something that is going to give you these cognitive benefits. And so Ayla is a class 1 medical device that enables you as an organization to have the evidence-based activities toolkit. It brings all of the amazing modalities and all of the kind of constructive CST into one platform that you simply log on to, and everything is there ready for you guys to go and get started. So I will tell you quickly about what that means. So it's 14 sessions, and we'll go and show you a demo in a very 2 seconds. 14 sessions. There's over 200 plus evidence-based activities in there. There's on-screen guidance. There's no prep required. As they said, that it's a 1-day training for carers. We upskill your activity coordinator or your care worker to become dementia therapists. They're CST trained. This is the first time this is ever happening. And as I said before, usually CST is sat in the NHS, and we are bringing it out of the NHS into the care homes where it should belong. We outcome track, so all that data that Antonina and Corinne were showing you, we collect pre and post survey data. So what we do is we send you these quick surveys for you to complete pre-CST sessions and post. It's very easy to collect. They are in line with the evaluation metrics that all of the clinical evidence and studies has been around. And you become upskilled in a really beautiful way to be able to collect this data. We take that data, and after 7 weeks, we show you the improvements. And that's what those graphs were that the team were showing you there. You can then use that outcome data to track for CQC and evidence against CQC. You can use it to report to families. You can use it as a marketing tool to kind of showcase how your organization is doing things differently, and actually you're improving the lives of residents, which is, I think, the first time we're ever been able to show this. And at the moment, it's fully aligned with the SAF, but we all know what's happening with the SAF, so, TBD. But regardless of that, we are able to really highlight, and you are able as an organization to show that your activities and your well-being is actually outcome driven, which has never really happened before. And that is fantastic. So this is Anthony. Actually, this is one of the best activities coordinators I've ever had the honour to meet, and he is housed at the South Care team, Grasmere. And as we said, it's a first of its kind qualification. It's soon to be CPD accredited, so that's brilliant as well. And yeah, telling your activities coordinators and having them qualified as dementia therapists is absolutely fantastic. They should be. I don't think activities coordinators are given enough empowerment. I don't think they're given enough qualifications to do the amazing job they're doing. So to be able to say that you have dementia therapists leading your activities and well-being, and they are CST trained, is really unbelievable, powerful. Here's the demo.
Let's explore how Ayla, your CST assistant, simplifies the delivery of this clinically validated therapy. To get started, we create a new group. Let's call it Sunnyvale Care Home. We configure the group settings, prioritizing key demographics such as dementia severity or age of participants, to ensure sessions are tailored to participants' needs and to ensure maximum engagement and cognitive stimulation. Once the group is set up, we enter the session menu, where you'll find 14 structured sessions aligned with the CST handbook. Each session includes expertly validated activities designed to provide structure and guidance to therapy delivery. Ayla offers 2 pathways to suit facilitator needs. In prepare mode, facilitators can take an in-depth look at the session, planning each step in detail. The deliver mode allows facilitators to dive straight into a session, starting with reality orientation, guiding participants through the date, time, and day before moving into engaging activities. Therapists can choose activities based on the group's preferences, ensuring a person-centered approach that resonates with participants. Ayla allows facilitators to explore CST sessions flexibly, adapting them to the needs of their groups. However, for best practice, we recommend following the sessions in chronological order to maximize therapeutic benefits. Each activity comes with supporting materials available for download to facilitate real-time engagement in group settings. From worksheets to visual aids, Ayla ensures facilitators have everything they need to create engaging and effective sessions with minimal effort. Ayla, your CST assistant, transforms the delivery of cognitive stimulation therapy by standardizing best practices, ensuring compliance against the NICE recommendations, and delivering the clinical benefits to all participants. By adopting
Perfect. I know we're running out of time, but that was the demo. And I just want to reassert that a lot of the questions we get asked is, I'm already doing activities in my care home, and and that's brilliant. People are doing activities. Activities need to be there. They need to be part of your care home, and these activities are wonderful. People do art classes, they do music, they do bingo. This is not just activities. This is an evidence-based therapy. This is proven to improve the outcomes of your residents. You can track those outcomes. You can delay cognitive decline. You can improve cognition, communication, and it's evidence-based, the point that it's NICE recommended. It's delivered in the NHS. It should not be sitting in the NHS. It should be in every single care home. It should be your first line intervention. And if you can improve the outcomes of your residents living in your care homes by 6 months to a year, you are going to have such a remarkable impact on the rest of the care home residents, but also your whole kind of team. And just a side note before we move on to the panel, which I think there would be a few minutes to answer questions, but some of our care homes now are opening up to external individuals. So bringing in people from the community to join these groups. Care homes can charge a nominal fee to invite people into their sites, some of our care homes are charging up to £150 for 7 weeks for people to join in. And that is amazing. You're improving your ability to market your care home. Those individuals coming into those groups get to see how the care home is, have a coffee morning. The family members get to see what's going on. Those family members can have the same reports that we're collecting. And it's wonderful. You can improve your kind of occupancy rates, hopefully. And just have that lovely way to kind of give something back to the community and create something valuable. So that's it from me. I'll hand back over to Fee and the panel.
Thank you. I think the way that this is set up is that we won't have time, unfortunately. However, I have been answering the Q&As as we've been progressing. So if you do have any further questions, my email address is in the Q&A, fiona@brain-plus.com, or you can email alternatively hello@ayla-care.com. As we wrap up today's session, because I'm conscious there's 3 minutes, I want to say huge thank you to Devika, Karim and Antonina, to everyone who's joined us today. We hope this session has given you a bit of insight into what the experience of Southcare has been in terms of implementing CST, some of the barriers, some of the challenges, and why ultimately the team at Southcare have found it worth it. If you'd like to learn more about Ayla or explore implementation opportunities, please reach out. I gave details before, but you can also again reach out hello@ayla-care.com or visit our website www.ayla-care.com. The recording will be shared shortly after the session. If you do have any further questions, please drop them in the Q&A. We'll respond over email, that's no problem. Our next webinar will be in a few weeks' time, and we will focus on the economic benefits of introducing CST into your care home, where we'll also be launching, I'm really excited about this, it comes up a lot, where we'll be launching our new ROI tool, helping you to quantify the value of this initiative within your organisation. So on behalf of the Brain Plus and Ayla teams, thank you again for taking time out of your very busy schedules and for joining us. And we look forward to seeing you at our next webinar, and hopefully some of you beforehand. Thank you again, team. Really appreciate your time today.
Thank you, everyone.